Hello everyone, my name is Nikki, and once again I'm here to just share my insights as a sonographer. If you're new, welcome, and if you're returning, welcome back. This video is part 2 regarding heart valve regurgitation. In my last video, we went over regurgitation of the atrioventricular valves, mainly the tricuspid and the mitral valve. And in this video, we're going to go over regurgitation in the pulmonic and the aortic valves, mainly it's the semilunar valves. It's also known as the semilunar valves. I also want to make a side note that in my last video I was talking about when it came to TR or tricuspid regurge that the right atrial pressure was from 0 to 15. It depends on where you're at, because I know some facilities that use 0 to 20 still, and I'm old school. I'm kind of one of those that use 0 to 20 scale, but I know that there is a variation. But keep 0 to 20 in your ballpark figure, and then you will adjust it based on where you go in the facility that you're at. I want you guys to remember that we measure mitral regurgitation and tricuspid regurgitation during systole, but we will be measuring pulmonic insufficiency or regurgitation and or aortic valve insufficiency or regurgitation during diastole. Up first, we're going to be talking about the pulmonic valve, which is located between the right ventricle and the pulmonary artery. Pulmonic valve regurgitation and or insufficiency can be visualized and assessed in the right ventricular outflow tract view, as well as the personal short axis view at the aortic level. Certain things that can cause regurgitation of this valve could be pulmonary hypertension, rheumatic heart disease, infective endocarditis, congenital heart defects, are just to name a few. You can grade pulmonic insufficiency from mild to severe using both color Doppler and continuous wave. When assessing regurge with color Doppler, you can basically grade it determining the length, width, and area of the jet. When it comes to continuous wave, you can grade it based off of the spectral tracing, the definition of the spectral tracing. Quick note, if you find any flow reversal in the pulmonary artery and its branches, it's suggestive of severe pulmonic insufficiency. Now we're going to talk about the aortic valve, which is located between the left ventricle and the aorta. Aortic insufficiency and or regurgitation can be visualized in the personal long axis view, the personal short axis view at the aortic level, the apical 5-chamber view, the apical 3-chamber view, as well as the subcostal short axis view at the aortic level. Certain things that can cause aortic insufficiency could be systemic hypertension, rheumatic heart disease, ventricular septal defects, unicuspid or bicuspid aortic valves, Marfan syndrome, just to name a few. Just like pulmonic insufficiency, you can assess aortic insufficiency from mild to severe using both color Doppler and continuous wave. When using color Doppler, you can determine the severity of aortic insufficiency by assessing the length, width, and the area of the jet. When it comes to continuous wave, you can assess the severity by the spectral tracing, as well as the pressure half-time that you would obtain on spectral Doppler. Certain numbers to keep in mind when it comes to aortic insufficiency are greater than 500 milliseconds it's around mild. From 350 to 500 milliseconds is moderate. From 200 to 350 is moderate to severe, and less than 200 is usually severe. Also, quick side note, if you have flow reversal in the descending thoracic aorta when assessing the aortic arch, that is suggestive of severe aortic insufficiency. Well, that is it for this video, and I want to thank you so much for watching. Please don't forget to like and subscribe, and if you have any questions or comments, please feel free to leave them in the comment section down below, and I promise to get to them as soon as I can. Until next time.